Hello. Many people suffer from an ankle injury after a run or sometimes after missing a step. Typically, it happens when the foot inverts and there is intense swelling on the outer part of the ankle region. One may find that the entire ankle is swollen, bruised, it's very tender on touching, and some may even not be able to put weight on it. Typically, it's most likely due to a ankle sprain, which may involve some degree of injury to the ankle ligaments. If you look at this model here, you will see there are important ligaments which are supporting the ankle. So typically, you have them on the inner part and also on the outer part. So when the ankle basically inverts and sprains, you can get some amount of tearing of this ligament, which typically leads on to an ankle sprain. Of course, if the pain is very severe and it's very tender, we need to rule out if there is a fracture which could involve the distal end of the fibula bone. Therefore, in the initial stage, it is important to do the RICE treatment, which is R for rest, I for icing, C for compression, E for elevation. Avoid putting weight on the leg, and to the nearest convenient time, get a consultation with your nearest doctor available and get it assessed. If there is a suspicion of a fracture, an X-ray will be done to rule out if there is a coexisting or a fracture involving the distal end of the fibula. Typically, if there is no fracture, then the diagnosis is most likely due to an ankle sprain, and all you need to do is to rest. You'll be given some anti-inflammatories and you'll be advised to avoid weight bearing for a certain period of time. As the inflammation gets better, you will then be allowed to partial weight bear, and with physiotherapy, often you will be able to regain stability and function of the ankle. Therefore, try and avoid injuries, especially when you're outdoors or when you're climbing up and down stairs. And if you happen to get a bad ankle sprain or injury, do not hesitate to get an early consultation to get a clear diagnosis of the problem. Take care.